The use of icobrain dementia really helped us making better reports in elderly patients. This software allows us to make quantification of brain volumes, segmentation of brain, and looking at volumes of different parts of the brain. That really helped us in making more secure diagnoses of dementia, or even looking at the brain and saying if the volume is normal or abnormal for age and gender of patients. This was something which was really impossible before we used this software.
I think the main value for neurologists is actually to understand where, in the case of dementia, for instance, the brain atrophy is more pronounced. And also for all those patients that think they might have some memory impairment, if they actually have some morphologic changes that would justify that feeling of memory impairment. So sometimes neurologists are requesting this quantification, not only to understand where the brain atrophy is, which is of course the most important part, but also to prove that there is actually no atrophy. Neurologists are actually demanding for the usage of icobrain in my clinical practice, and they feel that it helps them in patients with dementia and those patients that think they might have some memory problem. I remember a patient that I've been following up for 5 years, and for 5 years he wants us to quantify his brain in terms of atrophy. And it's very interesting to see the curve that he's doing along these 5 years that is actually exactly that expected by the algorithm. And now that I'm using it for 5 years, I can see the results over time. And that's very interesting to see how we can actually predict at some point the future.